Thank you so much, everyone, for coming and taking part in this. I know it's been a long day, but we've got some great information while we were here, and maybe we can take this back to our respective areas and really come to some conclusions on a lot of the topics that we heard here and talked about today. I want to bring up someone, and I'm going to give you what you should have, Gita, because Gita Rampersad worked with me on this event, and she did a fabulous job. And I'm just going to tell you a little bit about her because she deserves to have a little bit about her said. Gita is an award-winning mid-career population health professional and native of Chicago, Illinois. She oversees health equity initiatives designed to strengthen the public's health and address non-medical contributors to morbidity, mortality, and disease. She specializes in development of multi-sector groups to drive health improvement and advance health policy. Gita is Senior Director, Program and Strategy at the National Collaboration for Health Equity in Washington, D.C., an organization established to promote equity through action, leadership, inclusion, and collaboration. Gita leads its flagship national place-based initiative to advance health equity through the development of strong multi-sectoral networks that share data, leverage resources, advance policy, and disseminate best practices. She holds a Juris Doctorate from Loyola University Chicago School of Law with a certificate in health law and a master's in healthcare administration from the University of Illinois at Chicago School of Public Health. Now, in her free time, she enjoys walking programs, visiting art museums, listening to Cuban jazz, shopping at the consignment stores, and I think she doubles as a communications media person too, because we've been working together for the last few weeks, and I was about to propose because we were together so much. Ladies and gentlemen, please do me a favor. Please stand and give Gita Rampersad a round of applause.
I do. Right. Well, thank you, everyone. And first of all, thank you, Lloyd, for the proposal. No rings, you know. But also, not just for the introduction, but for serving as our Master of Ceremonies today. We could not have made it through without Lloyd. Not only with his support, but your voice and style that I've discovered was cultivated from a decades-long career in radio. So that's our trivia of the day. Yes, this is a trained expert over here. We only hire experts at the National Collaborative. But honestly, I sincerely hope that everybody here has enjoyed the discussions and that our speakers and our panels have inspired new opportunities for partnership and for dialogue. I really have felt inspired all day long today, very touched, very moved at times. It turned out better than I could have ever imagined, and I couldn't have asked for a better audience, so thank you. And better partners. We have so many great volunteers here that have helped to put this day together, as well as some of our staff, that I'm eternally grateful for everybody who's helped to make this a success. Again, we are having a reception as soon as I finish at the top of the Ponch, and it's our 10th anniversary for the program that I run, so please come up and enjoy some cake and a little more networking. I do want to say that this is my first rodeo here in overseeing an event in Detroit. Detroit has always been one of my favorite places, so when Brian asked me back in May to come to Detroit in November, I was eager to accept and start to get to work. And I'm really happy that we were able to make that happen. Here in Detroit, there is a lot to be proud of for this city. And I'm also happy that we have rebranded and rebirthed the Collaboratives for Health Equity program, formerly known as Place Matters, and that we have introduced 2 new communities to our nation. Flint, Michigan is one of our new communities. And Madison, Wisconsin is our second community. So both of them are doing incredibly innovative work to advance equity and improve community, and that's exactly what we're looking for. And this brings us to 21 communities across the country, blazing trails and inspiring action, so don't stop. I do want to take a minute, though, to extend my gratitude to my two bosses, Brian Smedley, the Executive Director of the National Collaborative, and Carla Galat, the Deputy Director of the National Collaborative. They believed in me somehow and trusted that I could pull this off less than a year into my new role at the National Collaborative. So I hope I've done you proud, and I hope that I can continue to do you proud. And thank you for the opportunity. I do want to mention about our conference theme. I know that throughout the day we've heard people bring it up, and I'm glad that it's resonated because our community conference theme is people, power, purpose. And for us, these three words embody and emphasize the value of community engagement, partnership, and real conversation that led us to today. And as you can see, a lot of stories can emerge from three little words. So in closing, I think after listening to the last panel and hearing Peter Hammer emphasize the positive and bring up, that we are, think about things from a victory perspective, I'd like you to try to begin to think about this week as a victory week. I know it's been a very difficult week, but we must move forward as victors and not victims. And we don't know what's going to lie ahead after the transition of power in the Oval Office. But what I know is today, over 200 community warriors gathered together, and we shared and inspired and connected and helped each other. And this was through helping each other through one of the most difficult and I think terrifying times in many of our lives. So that to me is very significant. And that to me, knowing that this room has my back is what's going to get me up tomorrow and keep doing what I want to do for the rest of my life, which is inspiring others to make a difference and not just to talk, but to act. So I think that we, as another panelist had noted earlier in the day, we do have a lot of work to do, and we have to keep working, and we have to keep training others. So let's keep doing that, because there are others out there that are waiting to take it from here, and it's time that we hand the baton at some point. So thank you for joining me today. Keep doing all of the wonderful work. Join us upstairs for a wonderful reception. And I didn't know, Brian, would you like to come and say one or two more words too, just to... Dr. Hamami and his team have been so wonderful throughout this process. He was going to share the spotlight with me for the closing remarks, but unfortunately he had to go to another meeting. So if you'd like to come and say a couple words, no? Okay. Well, that means we're released and we can go upstairs and party. Thank you, everybody.